Welcome back to the Mental Health Minute. I'm Dr. Emily Mayfield, a licensed psychologist. I want to thank you for watching this video and being a part of the Mindset Therapy family. By providing these videos, I hope to remove the stigma of mental health and help you find information that will allow you to make positive changes in your life. Please consider subscribing to my channel as a way to grow the reach so that more people can be provided valuable information on their mental health. You can also turn on the notification bell to be notified of the next video when it's uploaded. I will post a video every Tuesday and Friday, so check back soon. So for today's video, I'm going to discuss how to ask about suicide. If you know someone you think might be thinking of suicide, it can be scary to think of how to help them and ask them about their thoughts. In this video, I'll go over steps you can take to talk with the person you are concerned about. This video is a little bit longer, but all of the information is important. You might be the person that saves someone's life. Also, stick around to the end to hear the tip of the day. These are quick tips on ways that you can start to improve your overall mental and emotional functioning. So asking people personal questions can be difficult. When the question that must be asked is about suicide, it can feel scary and overwhelming. Finding the balance between showing concern while not giving the impression you're prying is a difficult balance to manage. However, when it comes to asking somebody about suicide, it's important that you clearly express your concerns and ask directly. When someone is experiencing thoughts of suicide, they often struggle with processing information and might be embarrassed to tell you how they're feeling and what they're thinking. If there is someone you are concerned about who you think might be experiencing thoughts of self-harm, it's important to know how to ask them in a way that they feel comfortable responding and is free of judgment. Asking about suicide can be difficult, especially if suicidal thoughts are not something that you've experienced before or you have never had the conversation with someone about. It can be scary, and you might not even want to hear their answer. If they do have thoughts about suicide, you might wonder if you will be able to help them or whether you'll respond in a way that will be helpful and not harmful. By watching this video, it shows that you are interested in learning more about this topic. I'll discuss some steps that you can take to ask about suicide and hopefully ease your concerns when it comes to this difficult topic. So first, let's talk about creating an environment that is supportive and comforting. To start, you want to create a space the person feels comfortable in. The topic of suicide will be difficult for you and the person who is having the thoughts. You want to create an environment of support in which the person feels comfortable. Find a location and a time the person is relaxed and more willing to talk. This will likely be in a quiet place, away from others, and when neither you nor the other person has something else going on. This will allow you both to be focused on the topic of suicide and not other distractions. So once the environment is comfortable, express your concerns. Let the other person know why you want to talk to them. Use I statements that express your concerns. When you use I statements, you take on the responsibility of your observation, and the other person will feel less defensive. For example, try to say, "I've noticed you have been staying home more, and I am concerned," and not, "You never go out anymore, and I don't know why." The second statement implies the other person is doing something wrong, and they will likely close off and not want to talk to you any further. Keep the conversation moving forward by having a relaxed environment. When you talk to the person, ask open-ended questions. Another tool to keep the conversation moving forward is to ask these open-ended questions. These types of questions allow for responses other than yes or no, which come from close-ended questions. For example, a close-ended question would be, "Have you been feeling okay lately?" The person can answer your question with yes or no and be done with their response. If you change the question to, "Can you tell me how you've been feeling lately?" This allows for more conversation and response from the other person. They'll be more likely to provide details on how they've been feeling versus just a yes or no, which stops the conversation. It is also important to note if you ask too many closed-ended questions, it might feel like an interrogation to the other person, which will also shut them down. Actively listen to the person when they respond. Give them the time to answer and encourage them to continue to talk. Now that you know how to talk to them where they feel comfortable, how do you ask about suicide? It is important to use direct language. When you ask someone about suicide, you want to use direct language. Don't beat around the bush. If you beat around the bush and don't ask the question directly, then they may not know what you are trying to ask. You don't want them to have to figure out what the question is, because they may answer the question they think you're asking, but it's not what you were actually asking. This will lead to you not getting the answer you're looking for and the other person confused. Recognize if you're feeling uncomfortable. Talking about suicide is difficult for the person asking as well as the person being asked. If the person who has had the suicidal thoughts already feels wrong in having the thoughts, they will be hesitant to answer questions you have. It is important to ask the questions in a way free of judgment. While you might be uncomfortable, you do not want to show this. If you appear uncomfortable, the other person may not want to answer the question because they can see you are uncomfortable and they may not think you could handle the answer. Appear confident and prepared when you ask the question. Understand that any response is possible and know how you will respond in all possible scenarios, which we will go over in just a few minutes. So now to ask the question. When you ask about suicide using direct language, you want to be as direct as possible. Some examples on how you can ask the question are, have you had thoughts of killing yourself? Or have you considered suicide? It might feel more comfortable to ask if someone has thoughts of hurting themselves, but this is a different question and can be interpreted in many possible ways by the other person. So let's talk about what to do with the response once you get it. So if the answer from the other person is no, you want to try to get more information on whether they have been struggling more, had thoughts of suicide or self-harm in the past, or have engaged in any other harmful behaviors such as increased substance use. This will allow you to continue to show concern while you assess their no and whether there are any discrepancies in what they've said that might raise more concern on your part. If the answer is unclear, the person may not feel comfortable answering the question, or they may not know what words to use in their response. If they are vague in their answer or appear as if they are holding back due to feeling uncomfortable, try to ask the question again and provide support. Don't pressure them to answer. Allow them to answer on their own time while you remain supportive and active in your listening. So what do you do if the answer is yes? So first, be aware of your nonverbals and how you respond. You want to allow the person to continue to feel comfortable and believe that you're not being judgmental. This will keep the lines of communication open. Thank the person for telling you and show support by offering to help them get help. If the person has a plan for suicide, it is important to get help from a professional. If there is immediate danger, contact 911 to have them transported to the hospital. If there's no immediate danger, you can take them to the emergency room for assessment. Many hospitals in large cities now have emergency rooms for psychiatric emergencies that you can also use. Most importantly, if the person does say they have thoughts of suicide with a plan, do not leave them alone until that you can get them help. Regardless of the person's answer, it is important to follow up. This shows that you have genuine concern for them and their safety. If they answered no, but really had the thoughts but didn't want to tell you, then you can help them feel more comfortable by keeping communication open. When you follow up, they become more comfortable and may open up to you in the future. It is worth noting that there is a difference between suicidal thoughts and an intent to kill yourself. As the concerned person who is asking about suicide, it is not your responsibility to know the difference between the two. It is important you get help for the person if you have any concerns for their safety. However, keep in mind that if someone is thinking about suicide, it doesn't mean that they will attempt to kill themselves. It can be scary to hear someone mention they have had thoughts of dying or killing themselves, but remember that doesn't mean that they will follow through. Get them to a professional as soon as possible to allow the professional to distinguish between the person's intent and level of risk. If you find yourself in a position where you need to ask about suicide, you might not do it perfectly, but don't let that hold you back. The concern you show towards the other person is often enough to help them get past a difficult moment. Try not to let your own fears and apprehensions hold you back from saving the life of someone else. So visit one of our other blogs on suicide risk factors to get more information on what to look for in someone who might be experiencing thoughts of suicide. You might be that person that saves their life. So now for today's tip of the day. Allow yourself to make a mistake. You can't learn something new if you hold yourself back from fear of making a mistake. Making mistakes are how you learn and can be positive. The issue is not with the mistake, but what you do with that mistake. If you enjoyed the content of this video, please give it a thumbs up. I look forward to seeing you at the next video. Have a good day.